All right. It is 4 o'clock, the time we now get together, at least Monday through Friday at the moment, to make sure that we remember, maybe now more than ever, with everything that we are currently experiencing, that we will get through this, and we'll get through it together. Say it with me. We will get through this. We will get through this together. And one last time, we will get through this. We will get through this together. We're going to get through this together because it's the only way that we're going to get through everything that we are facing. COVID-19 has certainly laid bare the inequalities and inequities in our society. What it's also done for a period of time is bring us more together than I have seen in my lifetime. And it helped us to blunt a curve, to stop a national pandemic that would have grown at an exponential rate. And I'd like to think that if that type of unity, if that type of embracing your neighbor, if that type of trying to leave aside divisions, if that can help us to defeat a 1 in every 100-year worldwide health pandemic, then I hope that that can help us defeat racism and inequality as well. Now's our opportunity to build the better world that's in front of us. Tonight, we don't have an additional update on KSP's current ongoing investigation. And tonight is primarily going to focus on COVID-19. And I think you all will understand because we'll start off with some really tough news in our fight against COVID-19. We'll talk about that first. We'll go over our numbers. Then I'm going to walk through, and I was going to do this on Monday, but where we are, where we started, and where we are fighting this virus. We'll talk about testing, then go over some great news that Humana provided this afternoon. Let's start with the really tough news. So today, we've got to announce that we have on our list of deaths today, we have a 9-month-old child from Hopkins County. Now, the lead cause of death will not be COVID-19, but the way that we have listed every other individual is that if it is a contributing factor, we list it on our COVID list. It's a 9-month-old. We grieve for everybody that we have lost to COVID-19, and far too often people think that it's something that only happens to medically compromised seniors. This is a reminder of how deadly this virus can be, how precious all of our lives are. And as a father of 2 kids, one of which I was scared at birth might not make it, I want this family to know, and it's a family I've never met, even in my dad's hometown county, that we, regardless of the what will ultimately be listed as the cause of death, we are grieving for you. And we care about you. I can't imagine how you are feeling right now. So let's have Dr. Stack give a few more details on this, and then we will get into our report for the day and other updates.
Thank you, Governor. So the update that I'm going to offer is about a couple of the deaths that we've had here today. The Governor mentioned a 9-month-old. In a normal world without COVID, the cause of death probably would have been presumed to be SIDS or sudden infant death syndrome. The case will remain open for this time while they try to better understand. But as is unfortunately often the case in circumstances like this, certainty is not possible. And because the infant tested as COVID positive, our reporting methodology has us list that as a COVID-related death. It is possible that COVID did directly contribute to the death. It's also possible that it did not. It may be one of those things we never come to find out for sure. For parents, I'd like to reassure you again, the statistics are that for children, they overwhelmingly do just fine. In fact, the vast majority of children have no symptoms of COVID. That being said, even though it is rare, the multisystem inflammatory syndrome that some children develop is particularly worrisome, because that does appear to develop so far at a frequency higher than Kawasaki's disease, which is a similar problem that some young children and adolescents have. And so I would encourage parents to not worry overly, but that you should be concerned, because for the individual, for the families for whom they suffer the illness or loss of a child, for them it is real. It doesn't make a difference if it's rare. For them it was 100% occurrence, and they lost their young loved one. So it's important that we're all careful with this disease. Sir, if the other one I might share, the governor, I don't believe he reported this, but one other death that he'll report is a 48-year-old male. The 48-year-old male is from Shelby County. This was an individual we were aware was COVID positive. To our understanding, was doing fine. Did not have any pre-existing conditions that we are aware of, and that they have died as a result. It would presumably be of COVID-19. This is obviously not in the high-risk category by any real measure we could identify. And again, though it happens infrequently in these younger categories for ages, it is a serious and dangerous disease, which leads me to my final point, and my heart goes out to the family members who have suffered the loss of their loved one. The weather is warm. It's going to be nice days ahead, in the weeks ahead. People are returning to activities. These are things that we have to do in order to move on with life and in order to get back to some sense of normalcy and have our regular activities and our economy function. I have tried all along not to be sensational about these things, but to be factual and to be even-handed. This is a very serious disease. It is not influenza. Because no one has been exposed to it, and because for the people it hits hardest, it can be particularly severe. It can rapidly spread. It can rapidly overcome the healthcare system. We've seen this happen in other places. So, return to your activities, but please follow the Healthy at Work guidelines. Wear your masks, practice social distancing, and please use enhanced hand hygiene, washing your hands and using hand sanitizer. These things are absolutely essential because we have no prevention, there's no vaccine, we have no treatment, and there is not going to be one immediately. And so for the time being, the only thing we can do is try to minimize or slow the spread of this disease. If people go to parties and hang out with each other and share saliva by shouting and yelling and singing and doing things that increase the spread of the disease, we will have a resurgence. If we're lucky, maybe the summer will help because the heat and temperature and the humidity will keep it suppressed, but there's no evidence that's the case yet. And so we may find that we have a resurgence in July, and we will have to hope the steps we've taken to prepare in other ways will help us to navigate that. But I have to urge and ask that everyone please follow the guidance that we're putting out there, play your role in keeping folks safe, and please wear a mask. If for some reason you choose not to, please respect the people who choose to. They may be protecting someone who's in a vulnerable category and at high risk. And for those of you who wear a mask, thank you for doing your part to try to protect others and the people that you care about and love. And please, this is not one of those things we need to make a big issue of between each other. Make your choice, try to follow our guidance, I urge you, and then just be kind to each other, and let's get along with each other so that we can get through this together better than we might otherwise. So thank you very much, Governor. Thank you.
All right, following that, we will go through our updates for today, and then I'm going to ask Dr. Stack to come back up and give his analysis of it. Today, we are reporting 265 new cases of COVID-19. Obviously, that number is up, and we have had numbers that are up, though they are not showing what we'll walk through before we were seeing in the beginning. of this virus. We do have to watch this pretty carefully. As I think Dr. Stack will tell you, as long as it stays in a given range, it may be fluctuation in day to day. It could also be the significant additional amount we're testing. Could also be the fact that we are now testing and we're about halfway through all of our long-term care facilities. Eric Freelander is going to give an update on that. So we're watching it. I don't think this 265 is a cause for alarm, though it is at least a reminder, just like what we've talked about today, that this virus is still out there and spreading. Our total number of cases in Kentucky to date is 10,410, 10410, 218 probable, the rest lab confirmed. It comes out of, and now we have some good numbers in this. I want to make sure that we present all of those kind of facts in context. Total number of tests, 258,767. We've got a bar chart, James, if you'll put that up, that shows how our testing program is really coming along. Now, we'll announce our sites for Kroger for next week, but we do not have enough people signed up for testing this week in Louisville, Lexington, Bowling Green, and E-Town. If they go online now, and we'll put up that slide later, you can still sign up. You can probably get in tomorrow or the next day in Louisville and Lexington. But look at this. I mean, this is our test. This isn't positive. These are total number of tests. As we began, remember when we began this whole thing, there wasn't a test. We had a limited number of tests when we had our first case, and where we are today is seeing, even though we were reaching the point we needed to reach, tests are continuing to increase. That's a positive. That means that if we can continue people going in to get tested, if there's not testing fatigue, then we can more safely reopen our economy. But more than that, just we can more safely protect our people, give people who need health care the help they need. Ever hospitalized, 2,317. Currently, 488. That's generally about where we've been. There are certainly significantly more beds than that, which means our healthcare capacity and total number of beds is not at risk. In the ICU, 950 ever, currently 68. That's one of the lowest numbers we've had in a while. So again, that suggests while we have more cases today, we've got a lot of capacity. That means we've got a lot of ventilators. Those are good numbers. And my favorite number, which is the numbers recovered, 3,283. And today we have a recovery story that I wanted to make sure we shared. It's Thomas Cartwright, who is a 74-year-old veteran just released from the Lexington VA hospital after being hospitalized for 63 days with the coronavirus, during which time he was on a ventilator, and you can tell in the picture that he was ventilated. The strength that got him through, the strength that got him through. I'm going to get a drink of water. Will you? Yeah.
I'll start at the start. Thomas Cartwright is a 74-year-old veteran just released from the Lexington VA hospital after being hospitalized for 63 days with the coronavirus, during which time he was on a ventilator. The strength that got him through this has been apparent throughout his entire life. Thomas served and was based at Fort Lewis in Washington and volunteered for 2 tours in Vietnam. He has been honored with numerous decorations. His strength is apparent through him and his daughter, also touched by COVID as a frontline healthcare worker at UK Hospital. She works in the COVID unit treating patients and continued to do so all while her own dad was fighting the virus at the VA. His daughter is now working to get her respiratory tech degree after seeing this need and her desire to help Kentuckians. Thank you for your strength, Thomas, and for passing it along. We are thankful for you, your service, and the service of your daughter. Is there a video?
My apology. As with most of us, there have been some long days and some long nights. Going back to our numbers, new cases, majority, or not the majority, but the largest number in Jefferson County with 55, Fayette County 37, Boone 30, Kenton 27, Warren 24, 8 in Davis and Franklin, 7 in Shelby, 6 in Campbell, 5 in Allen and Christian, 4 in Grant, 3 in Butler, Gallatin, Hardin, Logan, and Oldham, 2 in Carter, Casey, Clark, Hopkins, McCracken, Morgan, Spencer, and 1 in Barron, Boyle, Callaway, Edmondson, Fulton, Grayson, Harlan, Madison, Marion, Mason again, Metcalf, Nelson, Perry, Russell, Simpson, Taylor, Washington, Webster, and 1 unconfirmed. I think we now have had positive cases in all but 1 county in Kentucky, just showing that this virus is everywhere. Today, another hard number. We're reporting 8 deaths due to this virus. That raises us to 450 statewide. Only 1 of those is probable. All the others are lab confirmed. They include an 84-year-old woman from Gallatin, a 9-month-old little girl from Hopkins, 48-year-old man from Shelby, a 93-year-old woman from Jefferson, and a 92-year-old woman from Jefferson, and a 91-year-old woman from Jefferson, a 99-year-old woman from Edmondson, and a 91-year-old female from Edmondson. We need compassion now more than ever. Compassion for these families, compassion for our fellow human beings who are hurting. So let's make sure that we turn on those green lights, that we ring those bells at 10 a.m., and let's ring them for these families who are in pain. Let's ring them for all families who are in pain. When we look at the breakdown of race and ethnicity on total number of cases, 84.18% non-Hispanic, 15.82% Hispanic, and then on race, 74.21% white, 14.49% Black or African American, 5.28% Asian, 5.64% multiracial, and then in deaths, 96.61% non-Hispanic, 3.39% Hispanic, and then we continue to see this disparity in race in our deaths. Not only unacceptable, but what we have to fix. We have to fix. And we'll be announcing at least some plans here in the coming days. With the state and the Medicaid program being one of the largest payers in this Commonwealth, we ought to be able to start making systematic changes that get people the health care they need. And I'm going to use the resources of state government to work to make that happen. We are going to be deliberate. We are going to be intentional. We're going to be inclusive in developing the steps that we should take. But we are going to get some progress. I'm not going to be a governor who read off this disparity every day of this pandemic and didn't do something about it. I am going to do something about it. So of deaths by race, 79.62% white, 17.04% Black or African American. Again, that's 8% of the population. 1.73% Asian, 1.98% multiracial. As we look at our long-term care facilities, something that we have to track because that's where it is the most destructive, we have 15 additional residents, 9 additional staff. There's 10 additional deaths attributable to it. Again, when you look at 450 total deaths, and right now 253, and of those 450, there are probably a few more that are all coming in this area. It shows you how devastating it can be. With that said, I do believe that our efforts are working to stabilize this situation. When Secretary Freelander talks tomorrow, we've had a number of facilities, nursing home facilities that ought to be the most at risk, where everyone is tested negative. We didn't necessarily think we would see that, given what else has been out there. With that, I want Dr. Stack to come up again because we've seen where our numbers are today and give us his analysis on where we are, what we need to be looking for, and what these numbers mean to him.
Thank you, Governor. So all along I have resisted the request to point to a single tool that we've used to measure, because I've continued to emphasize it's a multi-source assessment. We look at a lot of data on an ongoing basis, and so I would say we have to do the same thing here. Some of the things I would observe, though, are that in our testing program that we do with Gravity Diagnostics, we have at least 3 different programs that we support through that. The nursing home testing, testing for hospitals and local health departments, and also testing through the Kroger. Going in reverse order, Kroger is sort of like a general population sampling. You have a lot of folks who are generally asymptomatic who get samples, and that's probably a decent snapshot of what may be generally available in a community for a positivity rate. And I haven't seen any large uptick in that percentage. And so generally it's about 1%. It can range anywhere between 0 to 2 or a little over 2%. Given the day or where we go. Sometimes we're in counties where the disease is more active, and other times we go to a county we haven't been to as much to try to see if there is active disease. So that positivity rate really hasn't changed much in the last 2-3 weeks. For hospitals and health departments, we support, it's gotten a little harder to keep this all in my head, but 70 to 100 different health departments and hospitals and some occasional other sites through that program. And the positivity rate there in the last 7 days has ranged anywhere from 1.1% to 4.4% or so over the last week. So those are daily numbers. And that has been relatively consistent over the last 2 to 3 weeks. Now, when we started this, we were testing very few people, and we were testing the highest risk people. We had positivity rates some days as high as almost 20%, but we were only testing maybe 50 or 60 people in a day. Now we are testing through our program alone, the state-based testing program in partnership with Gravity, close to or more than 5,000 people a day just through that one source. When you add to it all the other labs, both in the state and out of the state, who are testing, we easily exceed 6,000 or 7,000, or quite possibly more tests on our peak days during a week. And when we are testing that many more people, to have mild upticks where that's the wrong slide for this point, but that's okay, James, I don't think there's a right one for this. When we go between 100 to 300 patients a day, when the number tested is going up so much, but the positivity rate is not increasing, I think part of it is just volume. We're doing what we're supposed to do. Experts say we have to test enough people to try to get the positivity rate to around 3% overall. That's how we know we're testing enough people to find all the folks that we can with active disease, so that contact tracing has the best chance of being successful. So right now the data does not say that we're in an uptick. At worst, it would be a plateau of some sort. It may still be a downward slope. COVIDactnow.org, which takes publicly available data, including that which we report, calculates an RT. Someone asked me about what that meant a number of weeks ago at one of these press conferences. So that would be the rate of transmission as we experience it, and they put us at 0.96 using our data through June 2nd, and that's on their website as of just now. I checked on my phone before I came up here. Anything less than 1 means the disease is on a downward slope, it's decreasing. So for right now, it's good news, but remember there's a significant time delay. So if we're going to see a surge after a major event, it's going to be 2 or 3 weeks later that maybe we start to see a signal that there's a surge. And it's going to be probably a month and a half to 2 months later that we really hit a really bad place. So we'll keep watching carefully. We'll give you updates on a regular basis. And please, I already had 3 chances to be up here tonight. Please wear your mask, practice social distancing, and wash your hands and sanitize them often. Those simple things, if done consistently alone, would help us tremendously to minimize the spread. Thank you.
All right. I want to take a few minutes to kind of go back in time, talk about where we've gone with COVID. Then we'll just briefly announce that the testing sites for Kroger, and then we'll turn to the events in Louisville, and some really good news that I think can be some transformational news about an investment announced by Humana today. So, James, if you'll put up, this is just a recap of where we've been and where we're going. And the reason that I'm doing this today is multiple, is multi-part. It's not just because I intended to do this Monday, and there's going to be a lot of coverage of this, and there are different hearings out there. But it hit me today that if we can do this, we ought to be able to address other challenges that we face. If we can defeat a pandemic, and if we can reopen during it, and if we are committed to addressing the inequalities that it's laid bare, then we are capable. We are capable of major positive societal change, because what you're going to see in here is the reason that we are where we are in this virus is that we care about each other. And if we can make sure we care about everybody, truly everybody, then I believe that there's hope. All right, so very quickly, here's where we will go from the loss that we faced, the spread of the virus, early decisive action being important, the fact that just about every step we took, and even the steps were coming out, were specifically suggested or supported by the White House. There is no difference in what national and state health care guidance was, and then the challenges that we face ahead. So you saw this. This is where we are as of yesterday. 10,000 cases. Remember, we had our first case almost 3 months ago to the day today. 10,000 cases and losing 450 now people in 3 months. In 3 months. People talk about how, other illnesses, the flu, what this has done in 3 months, even with incredible action by Kentuckians, shows you how serious that it is. So remember that we only started seeing this, aside from some news coming out late December, in January of this year. We're almost now not quite 6 months through the year. How quickly this has risen. So the first case in the United States, at least the first reported case, was just January the 21st. And even by the 23rd, we were seeing a surge in Italy that certainly was devastating there. And very quickly, it hit in a couple places, overwhelming their healthcare capacity. What happened in New York is tragic. The lives lost, the capacity not being there, having to have trucks pull up just to house those bodies. What happened in New Orleans immediately after it got there, how hard it hit in Washington State, showed what this could do and what we faced if we didn't make significant preparations and take decisive action. The knowing that the PPE wasn't there, it was all manufactured overseas, knowing that there wasn't sufficient testing capacity and facing something that was growing this quickly. But as we are here today, and we'll go through all of this, what you see in Kentucky is while it is everywhere, the way we're taking care of our people, our mortality rate is one that pops out here. We're not just beating the national and the world average, but we're doing it with a population in Kentucky that's relatively sick, that has heart, lung, and kidney disease, more so than in many other places, yet still we are taking care of each other in very important ways. So March 6th, I will not forget it. I'd just gone home. I was just about to start playing with my kids, and I got a call saying that we had our first case. And we knew it was out there, and I'd already told our staff that the very first case we were going to declare a state of emergency because of how quickly this can spread. We'll look back, I'm sure, with time, they'll say they're good decisions or they're decisions we could have made better. I think this was a really important one that didn't just wake us all up, but it showed our commitment to addressing it. And then for those that were with us, were listening in, we started taking significant and serious steps every day. We certainly stepped up into those strong steps, but every day I and we talked with the public, talked about different things we needed to do, and took steps very early on that set the stage when our testing capacity would increase, but also, I think, helped people get the health care that they needed. This was the next week. And this was the next week. Again, maybe to a fault, that we were working on this every moment of every day, fighting to make sure we had the personal protective equipment that we could build up, the healthcare capacity and beds that we might need, that we had the ventilators. We went out and got all of the convertible ventilators basically in the state. And then on March 26th, Healthy at Home, which we'll talk about in a second. All of these followed recommendations made by the White House as we went through. Every closure that we made was one that was also in their guidance, even schools, travel, restaurants, elective surgeries, right? Elective procedures. This hit our hospitals hard. It was their recommendation. I remember being on the phone with the vice president, and he said, you got to shut them all down. We did, and that helped provide enough PPE to help us get through those times. Again, later, wearing a face mask in public came from the White House. And this was April 6th, the time when those next 2 weeks were critical. Kentuckians did really well during that. So Healthy at Home was a significant step. It was asking a lot of the people of Kentucky. And they did it. And because of their efforts, we saved thousands of lives. I believe when we look back on this, it will be 10,000 plus lives. I remember that the first modeling suggested that we would lose 80,000 Kentuckians. And in the first couple of weeks, while people were scared, some people were kind of having fun with the press conferences, and every day I'd look at that modeling and say, dear God, we cannot let this happen. Later modeling, we're still going to lose 33,000 Kentuckians. Because of what Kentuckians have done, that is not going to happen, and I'm forever grateful. We've had multiple studies now, CDC about the aggressive actions, U of L and UK, both having studies already saying that these actions saved lives. And the actions that we have taken and when we did them are very similar to what was done all throughout the United States. Red states, blue states, didn't matter, right? I really wish that would be the case now and the case going forward. I think a state is full of Americans and isn't simply a color based on political party. And I think especially now with what we're seeing across America, there are a lot bigger issues than political parties, and our responses and our reactions shouldn't break down based on them. Again, all of those steps were very similar to what was being recommended up and down. So the actions were not just justified that we have taken, they were effective. And that was always the concern, is could Kentuckians do it? Would it be enough? Every day I worried that it would not be enough to blunt that curve, and we didn't know, when it was going to happen. And thank goodness it did. And once we started seeing that, we had plateaued, and some of that data was coming out across the United States, the White House put out their guidance of opening up. And remember, even when there's criticism of what we're doing too fast or what we're doing too slow, we're following that initial guidance even still. This gives you up until some of our most recent numbers, and we'll have to put those in context. We were on a 2-week decline, something we had not seen ever in our experience with this. Even where we are right now, it is very positive to where we were going. Remember, I talked about the other day, we would have had 16,000 cases in 1 week in May, and the next week would have been 32,000 cases with the direction that we were going through those first couple weeks. And it wasn't going to stop spreading like that. I mean, that's what the evidence shows that it was doing. And remember, that's even with limited testing. And this is, again, shows you as this was starting and as it was spreading and spreading quickly, it jumped on us, and even actions we were going to take 2 weeks to go into effect. Look at the upward curve and look at how fast it was moving. Here we'd started taking some of those initial steps, reducing our contacts, but it was really on just about the 31st, 35th day that we saw healthy at home. And look what happened to that line, going up in a pretty significant way to starting to flatten out. Sure, small increases, but blunting the dramatic increase we saw. And then what we have seen in the past 14 days, the peak that's up there that you see that's right underneath it is when we tested the entire Green River facility, but now a downward trajectory. What hospitals have done, this slide is incredible in their abilities. Now where we are is our testing is increasing. You saw this slide today. We are in an entirely different place on testing. What we need to make sure that when we go forward is we don't have testing fatigue, that people are still going and getting tests, and especially if you've been in crowds the last several days or weeks, please consider getting a test. It helps protect you, helps protect your family, puts you on notice to watch out for your symptoms. Just make sure that we can keep you healthy. Contact tracing, again, there's some, I think there were questions today about whether it would work or whether we should be doing it. The White House says we have to be doing it. It's providing us hundreds of millions of dollars to do it. We're going to do it. It's going to help keep us safer. We've put out a phased reopening, not wanting to be the fastest. We're certainly not the slowest, but wanting to be the smartest. In general, what we see each day is we are either ranked in one of the best areas in the state, or we will go to that next tier, and then we will hop back up. But I feel, compared to the rest of the country, again, we're facing a worldwide pandemic, that we are in a better place. Our steps on reopening really fall right in the middle of what we are seeing around and throughout the rest of the country. Again, those actually every state up there, when you look at that, is governed by a Republican governor. Again, I don't think any of these decisions have been made this way, and we fall right in the middle. All right. So, despite on COVID, what has been a successful story, our loss has still been significant, and its inequity is unacceptable. Even when we have a great response, or maybe a historically good response to a pandemic, it is still a pandemic. And we have seen with the loss of human life, and certainly the impact on the economy, it's tough, it's rough. That's the reality. And in our past, when moments like this have happened, it's ushered in a new era in the United States, and that's what we are going to see here. Our lives are going to be different moving forward, but I believe that can also present real positive opportunities. This shows you record numbers of unemployment. I believe we are all close to, we'll get the numbers, 90% of all claims being processed. When you have 806,000 people file, and you're over 90%, I believe that number might lead even in the processing the country, but when there's still 10% of your citizens and it's that large of a number, it means that people are suffering, and we've got to continue to do better, and we're making changes to do better. And its impact on our budget is going to be devastating without federal help. Devastating. It's going to make it harder to make changes we need, harder to make changes that we need, that people are giving voice to right now. We're going to have that federal assistance. And next year's budget, without that federal assistance, isn't even going to be the budget that was passed. All right, we are having higher utilization. We talk often about just UI, Medicaid, which is operating very well. Sign-ups are operating really fast. Eric could tell you how quickly people are getting help. The SNAP benefits, pandemic benefits that are available that wouldn't otherwise be, there's a real positive story there he's going to share tomorrow. Listen, we are working as hard as we can in government to be there in people's time of need. And this is what we need from Congress. We talked about it. All right, all these steps that have been taken at different times, they have been challenged. There's been a couple of federal lawsuits. I think our Attorney General has challenged some of them, and others have as well. The United States Supreme Court had a ruling just days ago that basically said that in these times, I'm going to read it, the precise question of when restrictions on particular social activities should be lifted during the pandemic is a dynamic and fact-intensive matter subject to reasonable disagreement. Our Constitution principally entrusts the safety and health of the people to the politically accountable officials of the states to guard and protect. When those officials undertake acts in areas fraught with medical and scientific uncertainties, their latitude must be especially broad. Where those broad limits are not exceeded, they should not be subject to second-guessing by an unelected federal judiciary, and then it goes on. We believe that this is a ruling that's ultimately going to validate the steps that we've taken and resolve each and every lawsuit that's been out there. But remember, we didn't take these steps because anybody loves power or is trying to do anything. We took them to save lives, and that's what we've done. So it took a little longer than I anticipated, but I think it's important that we have the context with what we are facing. Very quickly, testing for next week is going to stay in Louisville, Lexington, Bowling Green, and E-Town. We need people to sign up. We are dealing with other very critical issues right now. I know that. We're going to talk about that in a second, but we have to make sure that we keep people safe during COVID-19. Sign-ups for next week start now, though you can still sign up for this week. There's still plenty of space. Let's make sure that we get all of those sign-ups done. All right, let's switch gears and still ongoing demonstrations in Louisville. Peaceful demonstrations last night with just a couple of acts of just individuals that we don't need to see, but incredibly peaceful protests, calls for change, giving voice to frustration and fatigue. And again, I know I've said this the last several days, but I'm listening. My goal is to hear and ultimately to act. I know it's seeking justice in this particular case of Breonna Taylor. I know it's wanting to see a quick investigation regarding Mr. McAtee, but I also know that it's about other inequities and inequalities that there has simply not been enough movement towards. I just want to talk about one piece of good news, because certainly one challenge, and it's only one, has been lack of investment, true investment. And today, Humana committed $11.5 million and significant employee volunteer service hours to advance healing and equity. This is one of the largest investments that we have seen. It's one that I've known about for a while. I know that they were waiting to announce it, and it was. I hope that I don't say anything that they were going to make a huge commitment before the demonstrations that we've seen. I don't know if it changed the amount, but this commitment from this company, I don't want to just say was reactionary. It was proactive. But with this, and I think I have alluded to this in the past several days, with what we've seen from commitments from Molina of 1,100 jobs, finishing that building from that was previously going to be built by Passport. Listen, we got a lot of different things we need to do, but we can also say that these are two positive steps Now what we've got to make sure is that they aren't just investments being made moving outside people into the community, that they actually lift up the community to build wealth, to provide more opportunity, more equity, and I believe that it at least presents the opportunity, if the time and the effort is put in, if we listen, if we work with community pillars, that it can be a big and important part of change moving forward. I lived in Louisville for 15 years, and this is one of the most significant investments, both of these, that I can recall. Want to ask Michael Brown to come up, and I know it'll be a short update on our KSP investigation, but to remind us that it is ongoing. They are committed to doing it quickly but thoroughly, and then letting the people of Kentucky know the truth, no matter what it is. I can tell you that I've been receiving updates. I am very impressed by the work of this critical incident response team. They are obviously very experienced in working these types of cases, and I will tell you, as governor, I have a high degree of confidence that they are going to get it right. Here's Michael Brown.
Thank you, Governor. Well, yesterday I came and I had reported the very beginnings of the investigation by the Kentucky State Police, and I want to give you what we can call an update. It's to let you know what we can expect as this investigation continues to produce results. As you may be aware, there are several types of evidence that come out in a situation like this. We have physical evidence. Those would include firearms, shell casings, all of which have been, when I say all, which were recovered from the scene, which are going to be subject to a variety of tests. And in fact, with the firearms and the shell casings, this is where one of our federal partners is assisting the investigation and conducting tests which can match shell casings to a specific weapon and test the weapons themselves. We have some visual evidence, some of which was released in the security camera footage that was put out by the Louisville Metro yesterday and is, I believe, in wide circulation, which can also assist in certainly showing some of the events that happened. We are hopeful to get some more visual evidence from body cameras, although people have to understand that once shots were fired that evening, most of the law enforcement people went to cover, and when you go to cover, that pretty much blocks out your body camera, so I don't expect to see a lot of that. And recalling the anecdotal evidence, it was reported to us that the National Guard, while in support of Louisville Metro, was at the scene at 26th and Broadway, reported gunshots, and reported returning that fire. And the result of which, of course, we know was the David McAtee was shot and he died at the scene. Yesterday I reported that we believed from the preliminary autopsy that he died of a single gunshot wound to the chest. We still are of that belief. We have not recovered a whole bullet, but we have recovered, I understand from today, some fragments. We are now in the process of trying to identify the very nature of those fragments to determine if they indeed came from one bullet or might have come from more than one bullet, and hopefully be able to determine the caliber of the bullet. That will be very significant because we have clearly identified that we believe, categorically really, that there were 4 people who discharged their weapons that night in the direction of the fire that they had received. 2 members of the National Guard using M4 carbines and firing .5.56 ammunition, and 2 Louisville Metro police officers. We have recovered from the scene 2 different caliber casings that we believe belong to the LMPD officers, so there's going to have to be a match if possible to see which ammunition went where. So we have the physical evidence I described. We also have forensic evidence we're dealing with, which in this case primarily will be the gunshot residue tests that were performed both on Mr. McAtee and some other individuals at the scene. We hope to have the results of some of those gunshot residue tests Monday. And again, I may have some information on the matching bullets fragments by tomorrow. To this point, we have conducted interviews that included we believe, all of the LMPD officers and all of the Kentucky Guardsmen who were not identified as discharging their weapons. That presents us with some anecdotal evidence that will take a little bit longer to match up their description of what happened with the actual physical scene. So what can we expect? I hope by maybe tomorrow, certainly Friday, we can get a clearer picture of the bullet fragments and that. We hope that by Monday we'll start to get in the first results from the gunshot residue test. And then thereafter, there may be a longer delay as we match up the visual and the anecdotal evidence to the physical evidence and the scene. The governor has instructed me to keep you and everyone else updated as we get information in. Thank you.
Now, we won't be able to provide much more information than that today, but I hope people see these updates and understand this is much more information than normally would come out during an investigation, but this is one where I know we've got to be transparent. I know that there needs to be a high degree of confidence in, and I hope it shows our commitment, the commitment of the Kentucky State Police team investigating, who again I have a high degree of confidence in, that we're going to get to the truth, and that I trust the people of Kentucky with the truth, regardless of what it is, that if we're transparent as we go and we explain it as we go, and then are able to provide people that evidence to look at or hear themselves, I believe that that we as a people can take it, and I have that trust in the people of Kentucky. Let's move now into questions. I know we've done a lot today. And we've got 6 folks with us here today. Actually, we've got 7 folks here with us today. And I have just a couple of questions that have been submitted. I didn't answer any of them from yesterday. I didn't mean to. That did get some of the folks that wrote them upset. But let me start here with one. Is there any update on a possible special session? We have been working with leadership from the House and the Senate, and I can announce today that we are in agreement that there will not have to be a special session. All we are looking at is the Transportation Cabinet budget. There is zero discretion in what needs to be done. It is a revision of a number. This is an agreement between all of the legislative leaders and the governor's office. So we do not believe at this time that there will be a need, and there's an agreement on the actions that have to be taken. Again, there is zero discretion in what has to be accomplished. So, Garrett, you want to start us off?
Governor, urged protesters at these rallies across the state to take precautions with masks and social distancing. Are you preparing for, or do you expect a second spike in COVID-19 because of these large groups gathering together?
So the groups that are demonstrating, that are giving voice to inequity and inequality, are doing so during a time of COVID-19. So I've encouraged people to wear masks, and I've seen significant numbers. I want to recognize that social distancing is a little bit harder during these demonstrations. What I would ask people to really consider is, in the coming days, get tested just to make sure. You might have somebody compromised at home. If you do have somebody compromised at home, be really careful because you don't want an act of giving voice and looking for positive change to harm somebody that might be at home. And that's why I think everybody are wearing one of those masks. But I'd highly encourage testing, and we have that facility, the Kroger facility in Louisville, that has, right now, next week we'll have 2,000 plus tests to do, and so if people are willing, it would be really helpful to make sure that we can protect one another. Do we think it could potentially lead to a spike? It may. What we're really going to find out is the impact of being outdoors and of weather. So, are yard sales allowed yet? Not yet. We're looking at when that could be. Obviously, the cleaning and the PPE and other requirements are a lot harder on yard sales, and it's also people's stuff, that's been touched that other people are coming up and touching. So we've got to make sure.
Louisville has hired an outside consultant to conduct a SOCAN review of the police department. Where are you looking for them?
The question is, Louisville is hiring a consultant for a review. We'll see what results come out. It's I think any time that we look at and think of how we can do things better, I believe that the vast majority of our law enforcement are professionals that want to do a really good job and that are always looking to try to do things better. And so if there are any lessons that we can learn, I believe those will be embraced by folks that, listen, there are a lot of emotions right now. There's a lot of emotions. There's the emotions that we're seeing of giving voice. There's probably some emotions of feeling underappreciated right now too. But I think that looking at policies and procedures and always thinking that with new technology and new techniques that we can always do better, I'd hope that can be embraced. Listen, every day I'm thinking about what I can do better, and I'm sure there's plenty. So.
It sounds like you guys are concerned about the possibility of a second wave here. So if and when we do see another influx of new cases, how quickly or how do you quantify when you'll have to actually pull back some of these orders that rescind some of the things that were put in place to begin with?
The question is if or when we see a second spike. Certainly a lot of people out there think that there may be one. When would we have to pull back things? That depends really on another set of numbers other than just the positive cases. Like right now, even though we had more cases than other than a couple of days that we've had, our ICU number is the lowest that we have seen in a long time. Our hospital capacity, we still have significant room. So it also means that we're finding asymptomatic cases at a higher rate that aren't going to need to go to the hospital. What they're going to need to do is to self-isolate. And so it won't just be our number of cases, it will be our ability to react to it and to keep it from spreading. If we do our job well on testing and on contact tracing, the people who have it are willing to protect their fellow human being and self-isolate, there is an opportunity to deal with a spike in cases that don't lead to a spike in deaths and don't lead to an overwhelming of our healthcare capacity that then leads to more deaths. The position that we are in now with the resources that we have that we can use directly on this virus are a very different place than when we had to put Healthy at Home into effect. When we did that, social distancing is all we had. It was all we had. We were fighting a virus without any of the tools that you need to do it. So I believe the position that we're in will mean a second spike will be dealt with more surgically with an ability to to know the small areas where we need to make those types of changes. But our goal will be to continue to provide updates, to continue to be transparent. And while there's some science behind this, it's also looking at the data, being fluid, and being able to react. It looks like the governor's office is scheduled to appear. It looks like no one from the governor's office is scheduled to appear for tomorrow's interim joint commission on the judiciary, even though the committee will be discussing the governor's emergency powers in a pandemic. Was the governor's office not invited to participate? The answer is no. We were not invited to participate. And that part concerns me, but I did see that the committee is adding, and I think they've put out a listening session at the end based on the events we're seeing in Louisville to listen and to hear, and I think that is a show of great leadership. Morgan.
How about for your not wanting to know if substitute teachers are still eligible for unemployment benefits now that it's summertime? Not a lot of people.
That's a very good question. I'll get you the answer. Lawrence?
What is your concern that with the public attention so much focus now on the civil level, that people will take their eye off COVID-19 and that would result in change behavior and possible spread?
The question is, am I concerned with the public not as focused on COVID-19? Could it result in a spike? Listen, the public is focused on really important issues that need to be addressed. But I believe that Kentuckians can do both. And I'm convinced by the number of masks that I see. And today there was a press conference, I guess was the right way to do it, on a group here in Frankfort on addressing racism on a 100-year anniversary of a lynching on the Singing Bridge. And I remember the invitation on that said, "You're not going to wear a mask, don't come." And so I think that there are ways to address both. And when this virus is disproportionately impacting our Black and African American population, I think we've got to do both at the same time. Tom.
Speaking of the,
Yeah.
I consider it a rally.
I told you I'd answer the questions.
Okay, this is the question.
Yes.
What were your thoughts of that rally and also of the apparent widespread support that was raised?
So today, when I walked out to a rally, a press conference on the back of the Capitol, it was actually the first public event that I participated in since the virus certainly started escalating. I expected it to just be about giving voice to issues that the demonstrators are, and almost every speaker talked about the group that hung me in effigy, and then marched over and stood on the front porch. Stood on the front porch chanting and heckling. Thank God my kids weren't inside. They would have been just feet away. And the fact that it was an effort to create fear and terror. The support was really overwhelming. Of people here in Frankfort. I haven't lived here long. Tomorrow I'll be governor for 6 months. 6 months. And I never thought that the people of Frankfort supported that, but to see, I mean, ever since then there's been chalk drawings on the front of such positivity. There have been these green things left on just about every thing you can hang them on from here around the Capitol. Some people painted some rocks and some plates for my kids and left them out. It's been really special. And for my kids, they weren't there to see the hate. They've only seen the love. But I want to make sure that I point out that while I had to deal with fear or terror for a day or for a week, those giving voice right now to their frustration and fatigue have had to face it for a lifetime, and their community has had to face it for the entire history of this country. What I faced is nothing. Nothing. Compared to what so much of America wants to see changed. And my hope is to be a part of that change and to continue to listen and maybe strangely take something from what I thought was a horrible experience. And while it can never give me the ability to understand, maybe it was just a moment where I could feel a small amount of what others feel. Karen.
John, you mentioned your children. Obviously, many parents are having conversations with their children about not only COVID-19 now, but everything that's happening with racism, being kind to one another. How do you have these conversations with your children?
The question is with issues out there of inequity and racism, of what we are seeing in our healthcare system. How do I talk to my children about it? It's not easy. But now I have a lot of conversations with my kids that are based on my job here. It's not easy. But part of it is admitting where we failed. And maybe sometimes as governor, one of the important things for me to admit is where we failed. And we raise our kids, and I hope everybody raises their kids to say we want everybody to be equal. But I think for far too long we raised our kids saying that people were. And our society has not achieved that. There's inequality in our justice system, in our healthcare system, in our laws related to voting, in just about every area of our society. And what I tell my kids is people are demanding that we finally fix it. We should have done it before now, but that doesn't mean we don't have a duty to do it now. And I've said this a couple times tonight. I'm convinced we are at a moment in time where our country is different. And there are moments in time in our history where our country has been different, key moments going forward. I hope that we can be different in a positive way. It's not just rebuilding our economy after the coronavirus. Maybe it's rebuilding a little bit of our soul. Maybe it's finally living up to some of the things that our founding documents say that we never achieved. Maybe it's time to finally be the country that we want to be, that oftentimes that we claim we are. And I think what we're seeing is, we're seeing overwhelming voice. We're seeing so many people join together, and I think it's time. Garrett.
Governor, you mentioned folks who are asymptomatic. Do you have an update on what the percentage of our positive tests are from people who are asymptomatic?
We think that's under 2, right? With
Well, maybe up to 1 in 4.
let's have Dr. Stack come up and address that.
So the question is, what percent of people may be asymptomatic with the coronavirus infection? And so there's still ranges for that, and I generally say, averaging things out, maybe 1 in 4 people might have no symptoms. That data will continue to evolve, and eventually what we'll do is, when enough people get infected, then we'll use antibody tests across populations, and then we'll get a better sense for how many people had antibodies. But now I open another door. I'm going to caution people. Don't go buy antibody tests for yourself individually. We're not there yet. Don't spend your money on cash on these. I've heard stories. I don't want to single out places, but places I could not possibly believe that I have been told that people are selling antibody tests that aren't licensed healthcare workers and that are maybe healthcare workers who really don't understand the tests. So don't get antibody tests unless you are at someone who is like an infectious disease specialist or an immunologist, somebody who really understands them and is using them for a specific purpose. There are uses for them, like people who are going to donate plasma for convalescent serum to help folks, people who have been infected who we need something else to help determine are they likely to be cleared of the infection. But in general, getting an antibody test is not a shortcut to say, hey, I'm good, I have antibodies, because the false positive rate is still high enough for a lot of complex reasons that if you get it, you're as or more likely to be wrong about your interpretation as you are to be right. So we'll know better. Unfortunately, this is like everything else. When we look back 6 months in the future and we look back, I could give you a much better answer to your question. But now today, I'd say maybe 1 in 4 people are asymptomatic on average.
Across the country, including in Lexington, we've seen these images of officers and other officials kneeling alongside protesters, sometimes even marching. There are some people that question the sincerity of these acts, but many people applaud them as powerful gestures of humility and solidarity. You had mentioned yesterday you plan on thinking of visiting protesters. Would you kneel with them if they asked you to?
Well, I'd want to talk to folks, but yes, I think I would. This is that was the start of a very civil protest that we're now seeing more people give voice to. And I don't think that there's, and today, the very first event that I've gone to, again, trying to model what we've wanted to see has been one on civil rights and on equality. And I think that's what you'll see going forward.
What are your thoughts about implicit bias training? Now the Lieutenant Governor called for schools and Democrats House or the House and Senate line for legislative ethics training. What are your thoughts about it? Where do you think it should be applied in the field?
We need it. We need that type of training in as many places as we can possibly get it.
With the world news of the loss this summer for the world, are you guys continuing to see kids testing positive for the virus? Have you seen any more cases of the inflammatory syndrome?
Kentucky has not seen any more cases of the inflammatory. We still see kids testing positive. The one today is, of course, the first one that we lost. But this one, again, a lot of factors, SIDS involved. But we have always, if someone tests positive and has passed away, we include them as a contributing factor. It's a positive sign that we haven't seen others. It might be milder in older kids. I believe that the 16-year-old, I think he was only in the hospital for a brief period of time. We're really blessed at the outcome of the initial 10-year-old who was on a ventilator. So we're watching for it, and we are very grateful that there haven't been other cases. Lawrence?
Is it the youngest person, right?
Yes, by far. I think we had a 30-something-year-old. Even the 40-year-old today is young for someone passing away, and there are no known other contributing factors in that one at the moment.
Can you tell us more about the Humana contribution? What that's going to do for exactly?
All right, so the Humana put out a news release this afternoon. $11.5 million focused on rebuilding, relief, equity, and inclusion efforts in Louisville, health of the community, greater health equity, and make the company's hometown more exclusive and more inclusive and equitable for all. 160,000 employee volunteer service hours to revitalize downtown Louisville and communities across the country. $11.5 million. 6.5 of it is going to ensure Louisville's Urban League sports and learning complex reaches its finish line. They're committing the funding to finish the entire project. And I know that project represents real opportunity in many different ways, not just as a sports complex, but as a place where so many other important activities like job training can occur. It's a heck of a commitment. And if we, every commitment and dollars invested are a good thing. It's then how we take it. It's then how we execute it. How we take full advantage of it. Whether it truly lifts up and creates wealth in the community, or it's just a helpful but maybe not a transformational step. Let's make sure that this is a transformational step. I'm going to do everything I can from the government side to ensure it is. But listen, Humana is doing a great thing here. A great thing. Tom? Nope.
They got questions.
Okay.
There were 3 in a row.
If some people are able to go back to work part-time compared to when they're full-time, maybe 10, 20 hours a week, can they still get a portion of unemployment?
Yeah, I believe at least the way that the unemployment statutes are right now, that people who have significantly reduced hours can still qualify for a reduced amount of unemployment. All right. I know we've gone long today, but we are at a critical time, I would say, in our country's history, and we got to get it right. And getting it right now isn't about the words of any elected official. It's about their ability to listen, to hear, to commit, and to take action. That's my goal. It's to do that in terms of COVID-19, to make sure we do not lose more Kentuckians than we have to, and it's my commitment in trying to create a more equitable society going forward. While Many steps shouldn't have taken this long in our history. Why not now? Why not now to finally make the important steps? And why not now to live up to the values that we claim and who we all claim that we want to be? My commitment is to do that each and every day, but I'm going to prove it in actions, not just in words. And we'll see you all at 4 o'clock tomorrow.